Do you really know how important your blood pressure is to your health? Hi, my name is Brittany Wilka, and I'm a student physical therapist assistant at Lackawanna College. And today I'm going to teach you how to manually assess someone's blood pressure and teach you the important factors of having your blood pressure taken. So blood pressure can be defined as the vascular resistance to blood flow. The heart is one of the hardest working muscles in the body, so you think people would be a little bit more knowledgeable about this muscle. But it's surprising to know how little people actually know about getting their blood pressure taken. According to the American Heart Association, high blood pressure, also known as hypertension, causes around 1 million deaths per year. If you do have high blood pressure, you're not alone. 80 million Americans, that's 1 in 3 adults, have hypertension. About 20% of Americans do not even know that they have hypertension. Taking someone's blood pressure is serious, and it should be checked regularly. So today I'm going to teach you how to take someone's blood pressure and teach you the important factors of having your blood pressure taken. So the first thing we're going to do is we're going to gather our materials that you will need to assess someone's blood pressure. So first, you need the stethoscope, and you will also need a blood pressure cuff, which is also known as the sphygmomanometer. The stethoscope will allow you to hear their heartbeat over the brachial artery in their arm, and then the blood pressure cuff is going to allow the air to pump into the bladder of the cuff. So before beginning the procedure, you're going to ask the patient a few questions that can cause discrepancies in the reading. A common question to ask is if you're currently on any medications. Since a lot of people do have hypertension, this is not an uncommon case of people being on antihypertensives. Another question to ask is if the person has smoked within the past half hour. If the person has smoked, you should probably wait about a half hour since they previously smoked, because smoking causes vasoconstriction, it causes vasoconstriction to the blood vessels that would cause an increase in blood pressure. So you normally take blood pressure on the left arm, but there are some contraindications to taking blood pressure that you would have to take it in their right arm. So some of these contraindications would include having a mastectomy on the left side, it being their stroke side, having an infection, or having a fracture in their left arm. So therefore you would take them all on the right arm. So today we're going to perform a two-step blood pressure. We're going to place the cuff over his brachial artery in his arm, which is just the top part of his arm. So first, for the two-step blood pressure, we're going to place our two fingers on the radial side of his thumb, and we're going to make sure that the dial is pushed all the way to the right. And I'm just going to feel for his radial pulse, and I'm going to pump the cuff up until I do not feel the heart rate anymore. Then you're going to slowly release the cuff. So his pulse rate was about 120, so you're going to add about 30 millimeters of mercury to that. So when I'm actually assessing his blood pressure, I'm going to pump the cuff up to 150 millimeters of mercury. So when we are actually taking blood pressure, when you're releasing the cuff, the first sound, that's also known as your systolic blood pressure. That's known as the contracting phase of the blood pressure. So that's the first sound you will hear. And then the diastolic is when the sound starts to fade away. So as soon as the sounds start to fade away, that's known as diastolic, which is also known as the resting phase of blood pressure. So before beginning blood pressure, you're going to take your stethoscope and you're going to make sure that both of the earbuds are facing inwards. Then you're going to take the bell of the stethoscope and you're going to place it into the antecubital space, which is right about here. You can feel for a pulse before, which is easier to hear. So since we did a two-step, I'm going to pump his blood pressure up to 150, making sure to listen for the systolic, which is the first sound, and then when the sounds fade away, the first one would be the diastolic. Making sure that the dial is pushed all the way to the right so that the bladder can inflate. So for his blood pressure, I got about 122 over 78. A normal blood pressure is 120 over 80, so you could give leeway of about 5 millimeters of mercury both ways. So he's healthy, and hypertension when taking blood pressure is anything over 160 over 100. So after that, you would definitely have hypertension and want to consult a doctor about taking medications or something. So now that we have assessed blood pressure, it's very important to note to have your blood pressure checked regularly. And blood pressure is known as the silent killer because people do not know that they have high blood pressure unless they get their blood pressure taken. This is a painless and an affordable test, so this can eliminate many health problems if you just get your blood pressure taken.